Imagine a lush green pasture, your dairy cattle grazing peacefully under the sun. Everything seems perfect until one cow starts coughing, then another, and suddenly your thriving herd is struggling for every breath. Lungworm, the invisible enemy, has arrived. This parasitic infection, often underestimated, can cripple the health of your animals and drain your productivity if left unchecked. But don't worry. With early identification, prompt treatment, and smart prevention, you can safeguard your herd and profits. Let's dive into everything you need to know to spot, treat, and beat lungworm in cattle. Lungworm, Dictyocolus viviparus, is a parasitic nematode that affects the lungs and airways of cattle. It is most common in young grazing animals, but can affect all age groups, especially those with no prior exposure or immunity. Keep an eye out for these classic signs: persistent coughing, especially after exercise, labored or open-mouthed breathing, nasal discharge and wheezing, poor weight gain or sudden weight loss, milk drop in lactating cows, depression and reluctance to move, sudden death, especially in heavily infected calves. These symptoms often mimic pneumonia or other respiratory diseases, but don't be fooled. Lungworm spreads rapidly, especially in warm and wet grazing seasons. Accurate diagnosis is key to timely treatment. Here's how vets usually identify lungworm. Fecal sample analysis, Behrman technique, detects larvae in manure. Serology, blood or milk. ELISA tests, measures antibodies to lungworm. Post-mortem exams reveal adult worms in the lungs and bronchi. Clinical signs and grazing history often point to infection before lab confirmation. When lungworm is suspected or confirmed, treatment should begin immediately. The longer you wait, the more lung damage occurs. These dewormers are commonly used: ivermectin, doramectin, ipranomectin, moxidectin. These are available as injectables or pour-on formulations. Always consult your veterinary surgeon for the best option based on herd status and lactation needs. Move affected cattle to a clean pasture to reduce re-exposure. Use anti-inflammatories or antibiotics if secondary infections are suspected. Provide hydration and nutrition support, especially for weak animals. Prevention is always better and cheaper than treatment. Here's how to stay ahead of the threat. Oral lungworm vaccines, live larvae, are given in 2 doses, 4 weeks apart. Start vaccinating calves at 8 weeks old and avoid dewormers for 2 weeks after to allow immunity to develop. Rotate pastures regularly to reduce larval buildup. Avoid overgrazing, which increases parasite ingestion. Monitor weather patterns. Lungworm thrives in wet, mild conditions. Deworm young dairy cattle before turnout and again during grazing season. Use long-acting products during high-risk periods. Lungworm can strike without warning, but you don't have to be caught off guard. Knowing how to recognize the signs, take swift action, and prevent future outbreaks will empower you to protect your herd's health and productivity. So the next time you hear a cough in the pasture, don't dismiss it. Investigate it. Because behind that cough, there could be a silent enemy. And now you know exactly how to stop it. Healthy lungs, healthy dairy herd, healthy profits.